A community-driven mental health program in Arnhem Land is being held up as a case study for the rest of Australia. The Elcho Island program has been running for almost a decade and is now helping the community deal with the aftermath of 2 tropical cyclones.
For the past 8 years, Galiwin'ku's mental health team on Elcho Island has been supporting clients and their families, assessing mental illness, working on suicide prevention and educating families about dealing with distress.
You cannot walk into a community if you're an outsider and think that you know the problem, think that you know the term psychosis or paranoia, or you have to understand the general context culturally.
The community-driven models got the attention of the National Mental Health Commission, who visited Elcho Island this week to meet the team.
There's a range of different best practice examples that could be useful not only for the rest of Indigenous Australia but for mainstream as well.
When Category 4 Cyclone Lam smashed into Elcho Island in February, followed shortly by another cyclone, the team was one step ahead. It's now helping about 300 people transition from life in tents to temporary donga-style accommodation.
What our mental health team does is work with people so that they develop their own solutions and work out their own strengths, rather than someone telling people you need to do this and that and you'll be fine.
They come and look for us, and we are the people that always open for them to help them in many ways in whatever they got.
The community hasn't had a suicide in 2 years, and although the team's not keen to take direct credit, it knows it's having an impact.
We did have clusters of suicide before. We've been getting the message across to every family that it needs a family effort for an individual to stay well.
The Indigenous-owned health service MeWatch is rolling the model out across East Arnhem Land. Felicity, ABC News, Elcho Island.